Good evening and welcome to the Sugar and Spice Parenting Girls with Bleeding Disorders webinar brought to you by the Hemophilia Federation of America's Families and Blood Sisterhood Program. I am Carrie Koenig, Families Program Coordinator at HFA. Also on the line we have Sanja Wilk, Marketing and Communications Manager at HFA. Just a few helpful hints before we get started. Tonight's webinar will last approximately 1 hour. We welcome your participation and questions. However, your audio will be muted for the duration of our webinar presentation by our system as it helps eliminate background noise. We do encourage your participation, and if you would like to ask a question, please utilize the chat tool on the bottom right of your control panel. We will then pass your questions on to our moderator. We will be answering all questions for our panelists at the end of the presentation. We would like to take a moment to thank CSL Behring, CDC Collaborative Partners, Aptivo Therapeutics, and Accredo for funding of our Blood Sisterhood program. Also, Genentech, Novo Nordisk, Bayer, Accredo, and the CDC Collaborative Partners for funding our Families program. Without their generous donations, this webinar would not be possible. Through our Families program and Blood Sisterhood programs, we identified a need for more information about raising girls with bleeding disorders. We compiled a list of common concerns to discuss. Our panelists generously donated their time and willingness to share their expertise. I'd like to thank them in advance for making this webinar possible. Joining us tonight on our panel of experts, we have Josh Hemann from Iowa, Martha Boria from New York, Destinee DiPrima from New Hampshire, and Tori Baker from Pennsylvania. Tonight from New York, we have Christy Van Horn. Christy is a program consultant with HFA. She will be moderating our panel discussion this evening. I'd like to now turn it over to her. Christy?
Great, thank you, Carrie. Sorry about the technical difficulty at the beginning, and I thank HFA for discussing this really important topic tonight. I'm really excited about this webinar. So we're just going to jump right into it. We're going to start with an introduction of our 4 panelists who are joining us from all over the country. So Josh, I'm going to turn it over to you, and we're going to have each of the panelists just briefly introduce themselves and talk a little bit about their bleeding disorder or their children's bleeding disorder. So yeah, go ahead, Josh.
Thank you very much. I guess a couple notes on, I have actually 2 daughters with bleeding disorders. My oldest, Jayla, is 8 with type 1 von Willebrand. And my younger daughter, we have 3 children. My girls are affected and not my son. Our 7-year-old daughter, Kinsey, has type 3 von Willebrand. So we have a kind of ranging severity in our house. Jayla does not treat very often. Typically Stymate or Amicar. Kinsey infuses very regularly, every other day, and more often than that, actually, for bleeding. Our target issues are typically nosebleeds, mucosal bleeds, GI bleeds. We tend to have a lot of that, and pretty heavy bruising typically. I'm excited to be on the call just to learn more from the other panelists, share our experiences. I guess where we live here in Iowa, we don't encounter a lot of other females with bleeding disorders. So my wife and I are always excited to hear from others, and looking forward to learning more.
Great, thank you, Josh. It's the wonderful thing about these webinars is that we can connect with other people from around the country. Up next, we're going to hear from Martha.
Hello, thank you very much. We have 2 girls, Alexandra, which is 20, and Julimar, which is 17. They both have von Willebrand type 1. Julimar bleeds more, which is the second one. They control their bleeding really well. They use birth control. That's the only pills that they use right now. I'm happy to participate in this webinar because sharing my experience with other mothers and fathers like Josh right now helps. I know helps others in the same situation that we are, and helping is always satisfying for me. So thank you.
Great, thank you, Martha. Up next, we have Destinee. If my computer works, there we go. Destinee?
Hi. Hi, everyone. My name's Destinee. We live in New Hampshire, and I'm a mom to 2 daughters that are 17. They are twins, and I carry severe hemophilia. It's been in our family for 3 generations, so it was kind of a surprise when we found out one of my daughters had severe hemophilia A, and her sister has a low factor level of 42%. We treat prophylactically ever since she was diagnosed, and she started walking fairly late, so we were kind of lucky in that sense. So she's been on a regular prophy schedule since she was about 15 months old, and now she, after they met their menses when they were about 12, we put them right on, both of them on birth control, because her sister also, even though she doesn't have severe, she has a low factor, so we found the birth control was definitely much helpful in controlling the bleeding, and they basically don't even get their period. So I was excited about this opportunity to join the panel because there's a lot of girls out there that probably could benefit from hearing from other families' experiences, because it's a little tricky for girls. And whether they have hemophilia or von Willebrand's, it's just not always easy, so it's nice to know that there's others out there.
Great, thank you, Destinee. And last but not least, Tori.
Hi, I'm Tori. I have von Willebrand's type 1 mild, as well as my sister and my dad. I treat with birth control primarily for my monthly cycle and DDVP prior to major surgeries. And then my sister, she also has type 1, but it's a little bit more severe, so she treats with Hemophilia for her cycles.
Great, thank you, Tori. We're going to hear more from all 4 panelists. We're really excited and thankful that all of them took the time out of their day to join us here tonight. So I'm just going to jump right into it. Our first topic tonight is how has having a daughter or living with a bleeding disorder impacted your daily life? And what are some of the challenges that you've encountered, and how have you overcome them? And for this first question, I'm actually going to start with Martha. So if Martha could maybe make a few comments about this topic, and then we'll move on to the other panelists.
Oops, sorry, I was in mute. The challenges, of course, were we didn't know anything about bleeding disorder. When we came from Puerto Rico, my girls had episodes of bleeding, but we didn't know. We thought it was allergies or problem with the chlorine in the swimming pool. So when we came here and they started bleeding with the first period, menstruation, I mean, we were scared. Good thing that we have good doctors and the HCT, which help us and train us in the bleeding disorders area. We went through this, and now my girls are awesome taking care of themselves.
Great, thank you, Martha. Josh, do you mind commenting next?
Yeah, and you mentioned the, I guess some of the issues we've had. Is that correct? The question, I just want to make sure I reiterate that.
Yeah. So the question was, how, for you, how has having daughters impacted your daily life, and what were some of the challenges, or what are some of the challenges, and how have you overcome them?
Yeah, I guess some of the challenges we've dealt with is, I guess the first one was learning to treat with Kinsey specifically. We treat her with factor, and we had a lot of issues with access as she was younger, with trying to access veins. So we ultimately did get a port for Kinsey, and learning to use that. Having someone available pretty much all the time to infuse, and just being cognizant of where we're at, having factor available, and none of the hospitals around us. There's one hospital that we can count on in our state that has the factor on hand. Otherwise, we travel with it all the time. So just being conscious of making sure we have medicine when we, I guess, with us at all times. And I guess more recently has probably been teaching her to infuse herself. And I guess my wife's a nurse, so she's a little bit more familiar with, being able to stick someone. So for myself, it's been more learning. And I guess one thing we've had with the two girls, one being Jayla not infusing and Kinsey infusing, is just kind of that balance between the two of them and making sure that they both know that we're, even though at times we're taking care of Kinsey a little bit more with her bleeding issues, that they're the whole family's included. So trying to keep that inclusion with everyone. And luckily Jayla's really thrown herself into that, helping her sister quite a bit, and they work together. So I guess just kind of managing the family aspect and also making sure that we are always prepared for those emergencies as they come up, and they do come up.
Great. That's really great feedback and insight. Thank you, Josh. Tori.
Yeah, there has definitely been an impact in having a bleeding disorder and, being a girl. Obviously, when I got old enough for my monthly cycles, I didn't really know that there was a treatment until I went to the HTC and it was managed. So the roadblocks, like Josh said, I feel like a lot of the community hospitals in the smaller areas, they don't really have much access to the factor, so it's really good to give them that educational background and have the HTCs, even if they're not close, inform the doctors on what to do in the case of a bleeding scenario.
Thank you. Up next, how about last but not least, Destinee?
Yes, having a daughter with a bleeding disorder early on was kind of tough because she was so little, her veins, not that it matters if she was a girl at this point, but she had to have a port, and it did impact our life. We had nurses always involved, but once we were able to take care of it ourselves, it was pretty much, we adjusted very well. And then as she got older, we knew the puberty was kind of over the bump, and we had to prepare for that. Luckily, because she has severe, she's followed quite closely, and our doctor was really helpful, being proactive, getting the OBGYN on board. So when things started, we were able to handle that. Nowadays, it's not really a big deal because we're treating it the way she is. It's a big deal in some ways because, it is a bleeding disorder, but she's adjusted and overcome all that stuff. It's more the daily trauma of being a girl in general and being in high school that's more of the front and center at this time in our life.
That's great. I hear a lot of talk of independence and self-advocacy in this topic, so really great messages. Our next topic is, actually, first I'd like to ask, does anyone else have anything else that they would like to add? Any of our panelists, is there something that we missed or something else that you wanted to share?
I know for Morgan, being able to take care of infusing herself at school is a big step. Now she's a senior this year, just started school yesterday, so that was a big deal to be able to take care of the responsibility of infusing when she knows she needs to infuse and not having to rely on mom to do it. So thanks to the camps that we've been in our community is wonderful up in this area, so we're very lucky.
Great. Thank you for sharing that. I think it's really inspirational to other parents out there. So thank you for sharing that. Our next topic is roadblocks to accessing care. I can't talk right now. So I will start with, and we've covered this a little bit already, but Tori, do you want to talk a little bit about your experiences with care and both? I'd also like if we could talk a little bit about successes that you've had. So yeah, go ahead, Tori. I'll pass it on to you.
Okay, yeah. I personally don't have to treat as much as my sister, so it's really, her story. Whenever she was younger, she got an ankle bleed from getting kicked in the shin, and the closest hospital, they really weren't informed about it, so they kind of were scared to have the factor because my parents would bring it in, and then the nurse would infuse it. but they didn't really know how to. So that was a good education moment for the hospital for us to teach them, and also the social workers with the Hemophilia Treatment Center. They helped with getting that over to the hospital for even us and any kind of future patients that would show up with von Willebrand's disease.
Great. Thank you. Destinee?
As far as roadblocks to accessing care, I would say the trouble we had was at the very beginning when I thought that she may actually have a bleeding disorder, because being a girl, they didn't expect that, and I knew I was a carrier, and trying to talk to her primary care doctor when she was a baby about my concerns. Most of the primary cares out there aren't real up to date with the ongoings of what hemophilia and von Willebrand's is. It's just such a rare condition for a lot of these doctors to see. So it was every visit when we were there, I'd always have concerns. Well, she's bruising, she's doing this, and she was actually a patient already at Children's in Boston for another condition with her heart. So at her one-year visit, I finally convinced the doctor to contact the HTC, and I just explained that I was a carrier, it had been in our family, and I suspected that she may actually have a bleeding disorder because she's covered in bruises, and anytime I would cut her nails or pull that little piece of skin off from her nails, she would ooze all night long. So finally they tested her blood when she was exactly 1 year old, and the next day called me to come back in because she had less than 1%. So once we got the final diagnosis, things were very smooth at that point. I think having severe, again, as I said earlier, in a way helped us get access to care because there was no question. And she had it. There was no concern about whether or not she was just a carrier or a symptomatic carrier. They took us very seriously at that point.
Great. Thank you, Destinee. Just a follow-up question for you. Have you lived in the same area your whole life as long as she's been a part
Yes,
of
we've always lived in we've always lived in New Hampshire, and we're right on the seacoast, so we're about an hour north of Boston, so we've always traveled to the HTCs in that area.
Great. It's great to hear that you have that support. That's wonderful.
We're very lucky.
Yeah, it's great to hear. Josh?
Yeah, I guess some of the biggest roadblocks and issues with access to care that we've had, again, I mentioned one thing that we've had is just probably with a diagnosis with Kinsey. We learned about Kinsey first. We didn't find out until she was 1 year old, and she had pretty severe bruising when she was born, and we had constant bruising and some bleeding throughout the first year or so. After getting tooth placed, she bled for a long time. I guess we felt like if she could have been a male, that they might have suspected something sooner. But being a female, that I guess our doctor dismissed it for about 1 year or so. We had I guess, with Kinsey being type 3, we did find out ultimately that both my wife and I have low factor. We don't really have symptoms a whole lot as adults. Both of us really did as children, but nothing was ever suspected then. So I guess not seeing anything in our family history, they didn't think anything about Kinsey. But which once we found out about Kinsey, it was a lot easier to diagnose Jayla as type 1. Since she had some bruising, and obviously we knew about Kinsey's history as well. Some of the other issues with access we've had to care, most of those have not specifically been due to being a female. It's probably more to the rural areas and just kind of living in a smaller community. Once kind of unfortunate, we had actually moved from where we were at, which was about 10 minutes from our HTC, to about 2 hours away, a few days before we found out she had von Willebrand's disease. So it was unfortunate timing. Wouldn't have changed anything, I guess, probably for us, but it was just kind of ironic timing, I guess.
Thanks for sharing, Josh. And Martha, I'm actually interested to hear your story. So I know Martha moved from Puerto Rico, so I'm wondering if she could maybe talk a little bit about the difference between care in Puerto Rico and here in the States. And maybe there isn't much, maybe there is a lot, but Martha, if you wouldn't mind talking a little bit about that, that would also be great.
Sure. Sadly, I have to say that in Puerto Rico, doctors and nurses, they don't know anything about bleeding disorders. They only know a little bit about hemophilia. So, of course, my girls were 8 and 12, and we didn't know about bone rearranged disease until we moved to the States. So, but I'm happy to say that our experience assessing the HCT and the treatment was always available. Nurses and social workers, they were always helpful. We have a good support there. Unfortunately, in Puerto Rico, there's no education and they don't know anything about bleeding disorders.
Martha, if I could just ask a quick follow-up question. When you moved to the States, how long did it take for you to realize, or how long did it take for your girls to be diagnosed?
Less than a month.
Wow. Great.
Yes.
Wow.
Yes. That's what I'm so happy, so grateful, and we love to help because of that. I mean, it was amazing how fast the doctor said, these girls have this, let's treat them.
Wow, that's wonderful. Great.
Yes.
Well, thank you all for your comments. This was a really great discussion. Moving on to the next topic, we're going to talk a little bit more about prophylaxis. So it's Destinee, if you don't mind starting us off, if you want to talk a little bit about if your children are on prophy, do they self-infuse, when did they learn? I know you already mentioned a little bit about this in your daughter. So yeah, if you want to just talk a little bit more about it, that would be great.
Sure. So Morgan was tiny, and she got a port when she was 15 months old. So we had that port, and I infused her until about 4th grade, and the port started acting up. So she had it for about 8 years, and then at that point we took it out and we started to learn to self-infuse, or access her veins, I should say. She really was not in any way, shape, or form ready to self-infuse. We go to a NEHA camp up in New Hampshire, and a lot of these younger kids do infuse early on, and she is a little bit slower to that, which was totally fine. She eventually got it, and now she is self-infusing on prophylaxis. So she does it about twice a week now, and does need it if she needs to infuse for another reason. But she does very well with it. Occasionally she misses, but most of the time she does have no problem accessing it. And she has, of course, her favorite spot, which I wish she had more than one favorite spot, but there's some concern about her veins. But she's doing well.
Great. Thank you for sharing that. Again, very inspirational. Josh?
Yeah, we actually started, we did find out at a year old. So actually the first year of Kinsey's life, we treated on demand. And that was a rougher time, I guess, for us, just being more reactive than proactive on our end. It was a big change for us when we did move to prophylaxis. She had a lot of significant bleeding throughout that first year. We had a lot of ER visits, hospital stays, so prophylaxis was good. We started that 15 days after she turned 2. The date sticks in my mind pretty well. And we, at that point, we were doing 3 times a week, Monday, Wednesday, Friday. And we did that for about a year. And then after that, since she turned about 3, so like the last 4 years, I guess, a little over 4 years now, we have been doing every other day. During that time, we were doing 3 times a week. We typically have a bleed on Sundays, and it was a pretty consistent thing. So our treatment center did talk with us. So we worked with them and expressed our concern, and we'd moved to every other day. We have seen a lot of benefit to that. Just typically, she's got kind of a short half-life on You know, with the monoglobulin factor, it doesn't goes out pretty quick with her. So we do infuse every other day and still have occasional bleeding. We had a stretch for about 4 months there that we had no bleeding, but that was a couple months ago, and that was where we lost another tooth recently and a few bloody noses ago. But she does pretty well with the prophylaxis. We've beginning of this year of 2016, we started using her veins. We tried to transition her into that. She was not a big fan of that originally, but we just kind of said this is what we're starting on, and she picked it up pretty quick as far as allowing us to do that. It started out with my wife kind of doing a little bit more, and then we had some nursing that kind of came and helped. They're actually still coming, you know, for the last several months. They've been helping myself. I've gotten a lot better, and then we've kind of gotten Kinsey into it. I believe in June we started with her trying on herself, and she's done very well with working on her veins, and we've been she's not real consistent with it, but she's getting better, and just I guess one of the biggest issues for us with that is just kind of an attitude and just kind of making sure she's kind of in the right mood to do it each day. But the prophylaxis has been a very good thing for our family.
Great. Thanks for sharing that. Yeah, I'm sure. I mean, it takes time, right? It's not going to happen overnight. So that's great. Martha, what about your girls?
My girls, right now, they're in birth control. They both have used nasal sprays and pills, but nothing works. The only thing that works best is birth control.
Great. Thank you for sharing. So what about other, like, bloody noses and things other than menstruation? Do they have any bleeding otherwise? Or
Julimar sometimes have a nosebleed, but she takes control of that. But she doesn't have to use the nasal spray and Amacar, not anymore.
Did she used to?
She used to. Yes, she used to. But with the nasal spray, Alexandra had an allergy after that, so that's why she stopped using it. And Julimar also, let me see, she had also, yes, allergies after she used the nasal spray. That's why the doctor started using other stuff. But we are fine with the birth control right now.
Great. Well, thank you for sharing that. And last but not least, Tori. And I just want to point out that the photo on your left, that is actually Tori, I'm assuming, at camp. Is that right, Tori?
Yeah, I did it at camp because my sister, she self-infuses. She has probably for 4 or 5 years. She's 18. But she does really well with that. She does it once a month, and it's helped tremendously. It's for her monthly cycles, but she does have joint bleeds that it helps with that too.
And I'm sorry, did you say, do you use prophylaxis or just your sister?
Just my sister.
Okay. Great. So moving on to our final topic, and then we're going to open it up for questions. The big topic, the one we all need to talk about, and I'm sure is a source of anxiety for a lot of parents with girls with bleeding disorders, is puberty and menstruation. So I'm going to start, Tori. I know that I just called on you last for the last question, but I'm actually going to start with you. And if you want to talk maybe about your experience and your sister's, or just yours, if you don't want to speak for your sister, if you could talk about, early on, did your parents talk to you about it? What was helpful? Tricks to help through heavy periods? How did, through school, and do you play sports? I know this is a lot of questions, but pick any of them to kind of just start the conversation about this. It would be great.
Yeah, so 1 second. My parents are coming home. My dogs are barking. 1 second here. Of course. Okay, so for me, menstruation was a big deal. I feel like whenever I first started, it was super heavy, but my mom knew we had bleeding disorders, but she said, oh, we treat with that with, just heating packs, that kind of thing, because I don't think she really knew what kind of options were available. So it wasn't until recently where I really got them under control with via birth control, as well as others on this call that have said that. So that actually really was a change for me, because I didn't realize there were options to make my period less heavy, because it was just a very embarrassing experience with leaking through and using a lot of tampons and pads, just things like that. So really finding what works for you is best, because birth control worked for me, but it didn't work for my sister. She had a lot of complications from that, so it even can differ between siblings. She treats better with the biologic factor, and I treat better with the birth control. But so that's just a good thing to keep in mind. Just different siblings can be treated different ways. In high school, I played sports, so that was really a big issue in that, because I swam and I played tennis, so it didn't hold me back, but it was definitely something that was just annoying, and I didn't realize that I could get relief from it until just a couple months ago.
Thank you for sharing. I might ask some follow-up questions, but I'm going to turn it over to Martha. Martha, you've already mentioned that both of your girls do really well with birth control, and it's helped them a lot. So I'm going to ask you a few other questions. When did you, I'm not sure how old your girls were when you moved here. I'm sorry. I think they were 8, maybe. How old were your girls when you moved to the States?
8, yes, 8 and 12.
Okay, wow. I do. So I did remember that. So how did you manage the period talk and the menstruation talk when you found out, or when you knew they had bleeding disorders? Can you talk a little bit maybe about the history, because we already know they're on birth control. So maybe you can talk to us a little bit about the early on.
Sure. I mean, we were devastated. When I'm telling you devastated, we were crying every single day when menstruation happened. Julimar was 9 years old. I mean, can you imagine? She was a baby, and then a bleeding disorder that we didn't know she had. It was sad. It was really, really, really sad. She bled her menstruation was so heavy, that the teacher always called me from school. Alexander's period was heavy too, but not like Julie. Julimar was so heavy, that's when we knew that something was wrong. Something was not normal. That's when we decided to go to the doctor, and in less than a month, she told us about the bleeding disorder.
Right. Thank you for sharing that. Can I just remind all the speakers and the panelists to turn off their speakers on their computers? It might be where the echoing is coming from. Everybody do that for me. Just a reminder to turn off any speakers or computer mics. So next up, to talk about menstruation, we have Josh. And Josh, I know your daughters are a little younger still, but have you started to think about this? I know you mentioned your wife is a nurse. Do you want to just talk a little bit about this?
Yeah, like you said, my daughters are 7 and 8, so we don't have a lot of experience with this, but I guess I will come at that topic from a, father's perspective on, to be honest, when we had daughters, I didn't think this was ever going to be something I would have involvement in, or, I thought it would be, I thought the menstruation would be something my wife it would be something she would help handle, and I would have no involvement in. to be quite honest, as a father. So, now that I'm going to have to be a lot more concerned and kind of aware, just based on bleeding, make sure that treatment is happening, whether it's birth control, most likely for Jayla and Kinsey as well. But Kinsey also need to make sure we are treating as needed, and just make sure I'm, I guess, more aware than I ever would have expected to be in the situation. So we don't have a whole lot of experience on it, but I'm knowing that that's coming in a few years.
Great. That's why webinars like this are so great. Maybe you can learn a few tips. And last but not least, Destinee.
Yeah, so I think I've touched on this already a little bit, but that was probably our biggest concern, is having a daughter with a bleeding disorder. When we found out Morgan actually did have hemophilia, so we were kind of preparing for ourselves from the very beginning, and things started around age 12, and she is a twin, so luckily her sister's a little bit further along with things, kind of always has been the pattern, and she started first. I mean, she has lower levels. She's at 42%, so it was kind of like a test drive for us. So we put her on the pill right away with advice from our doctors, and they both are on it now, and they've been taking the same medication for, well, they're 17 now, it's almost 5 years, and they don't really get their cycle anymore unless they miss a pill. It's very important that they take it at the same time every day, and they don't forget, because they will start. And Morgan does not do very well with that. She's very sensitive, and it's probably the hardest thing about being a girl, I think, and strange as it is, sticking herself with a needle. They amaze me how much they can overcome. That doesn't bother her as much as actually getting her cycle. So these kids can teach you a lot, because they definitely can make it through with some rough patches along the way, but they do get there, and it's all manageable. I mean, at least for us it is. It's our story. Everybody's different, but I will say it's puberty. We're at 17 now, so we're making it through, and we'll get there.
Great.
It's always
so
pretty, but it's
yeah. Good for you. I know all teenagers deal with this, right? Well, in a different way. In a different way. But I do want to ask just a couple, and I'm going to open this up to all of you panelists. I think this is a really important topic. I mean, all of you have even mentioned that it is. I'd love it if somebody or one or two of you could share maybe a personal story or tips that you have for the parents out there, talking to your children really young, making sure that they understand what's going to happen. But maybe just sharing, like Tori, maybe if you could share, did you play sports? How did you, does anybody want to volunteer to answer one or two of those, either telling a story or giving a couple of tips?
Okay, well, the silence is awkward, so I'll step in. I know, for being a mom and a carrier, that I had some heavy issues early on, and my mother as well. So we were pretty open with the girls, and in some ways, I don't want to call it a blessing, because it's not, but it gives you the opportunity to talk about it. And a lot of kids go through this stage of life, and it just kind of happens. And where you're already kind of have a head start, because there might be some rocky roads ahead, it's kind of nice that your kids are really going to be prepared to handle it a little bit better than maybe someone that didn't get to talk to the parents. It opens up doors of communication in a way. And I guess if you're looking back, or at least I can look back and say that was kind of the silver lining of it, is that we're very open.
Great, great. And it is. I mean, it almost does force you to talk about it, and that is good. Kids do want to learn this information from you. So that's a really great point. Thank you. I am going to move on, but does anyone else want to add anything? Okay. So last but not least, maybe the most important part of this webinar tonight is our questions section. So if we have any questions, please type them into the box, I think. This is my first time using the questions box here. So, please. I have Sandra there to help me.
Yeah, Chrissy, let me know if you don't see them, and I can relay them to our panelists.
Okay, great.
If you
a good question from Carrie. My daughter is, and I will just, I know Tori just had to jump off, but the three panelists that remain, I might call on one of you to respond to this, and then we'll open it up to the other panelists to comment as well. So the first question is, my daughter is covered in bruises and just started 3rd grade. She has become super self-conscious about them. Any advice? Josh, do you want to take this question?
Yeah, I guess not sure what great advice I can really give, I guess, but Kinsey hasn't become too self-conscious with some of it. I believe part of it because she's, a lot of her friends are very comfortable and know what's going on with her, and kind of her, that she does bruise easily. Her friends we don't push it a lot, I guess, but her friends know we've infused in front of her friends. We've had to do that. And we make it known when it's appropriate, but we don't try to push it too much. But so I don't believe Kinsey feels too self-conscious about some of it. When it comes, she's also very active, likes to be involved in like soccer and like football, which our doctor is not a big fan of. But she likes to be involved in that stuff. So I guess to her, sometimes that's kind of like a little badge of working hard, or that that she's playing hard, and it's just been something she's always been covered in. So she doesn't think a lot about it at this point. But again, she's in 2nd grade, and we haven't encountered a lot of that. But obviously as kids get older, they can get a little bit more self-conscious, and we just haven't encountered a whole lot of that. And a lot of the people she encounters are familiar and kind of understand why. So she, they don't look at her weird or really make comments, or I mean, there's nothing that really comes up. It's just that's the way it is.
Thanks, Josh. Destinee or Martha, do you have anything to add with your girls growing up with bruising?
Morgan really didn't show too many bruising because she was on prophylaxis. So we really didn't have that issue, and she still, even now, she kind of has one of those attitudes.
Question. I'm going to just throw the question out a little bit different. So
sure.
How any of your girls became self-conscious, how would you deal with that? How would you deal with making them feel better about it, or dealing with it at school, with peers? I'll rephrase the question. How about that? How would you deal with the self-conscious?
Gosh, it's tricky.
It is tricky.
Yeah, on the spot. I'm sure I'll think of something after I hang up, but I'm not sure. It's such a hard thing for girls. I think they want to be accepted, and I don't know, wear pants. I really don't know.
Oh, no.
No, that's probably not very helpful.
I'll share. I don't have a bleeding disorder, but when I was little, my beauty marks, my mom would call them, all my, like, the brown little moles I have on, I was so ashamed of them, and my mom started calling them beauty marks. I think even putting a positive word to it, or just reminding them that they're beautiful, and just kind of, feeding into the positive side of it. It makes them stronger, or making it in a positive way, however you do that, whether it's through calling it something positive or just reminding them how beautiful they really are at the end of the day. I think that's a really good question, and I know how super hard that must be to answer. I'm going to move on to another, because we have a few questions. Actually, we have quite a few questions. So I'm going to move on. One is for you, Destinee. I'm wondering, is your daughter with severe A from you being a carrier, or is there something else?
It's a great question. I get it quite a bit because typically girls don't, in the past, get hemophilia. My husband does not have hemophilia, and it was a shock to the doctors when we found out Morgan actually did. And basically, they determined the cause of it was because my daughters are identical twins. And during the development of the twin, when the eggs split, the inactivation of the X chromosome didn't take place yet. So, not to get all sciencey on you, because I'm really not, that's kind of over my head, but the basic, something to do with the twinning, because they are identical twins, and they're not the only ones. There's another set of twin girls that has this very similar situation. One has severe, and one is a carrier, and it is rare, but it happens. And other than that, you know, my uncle had it, and my cousin also had it. They were boys, though. So we carry the regular, normal hemophilia A gene, but it just happened to be something to do with the twinning.
Great. I have another question for everyone. Well, Josh, you might not be able to answer this quite yet. I know a lot of you use birth control for periods. Is there anything else other than birth control to use during monthly cycles? My daughter is 11 with type 1 BWT and has not yet started. Just curious if there's any other options.
I know can you hear me? I don't know if I can chime in.
Yeah.
So I know we live in New England, which is a bunch of different states in our local chapter, and I know of another family who has a daughter with von Willebrand's, and I'm not sure which type, but I know it was pretty severe. And she did try the birth control pills, a couple different ones, and I know recently she had an IUD placed and is doing very, very well. She's about 17 years old, and this is the best thing that has worked for her. Again, that's not medical advice. I'm just giving you what I know of other people have done. So I actually, yeah.
No, thank you, Destinee. That's a perfect segue into what I was going to say, is I really think, you know, there's all these different types of research or medications and birth controls out there, but really the best thing to do is talk to your doctor about this. I think it's great that everybody's sharing their experiences with what treatment they use, but at the end of the day, I think it's a great message to send home that we all talk to our doctors about what's right for us and what's right for our children. So that was perfect segue into that. Thank you. Martha, anything to add to this one? Martha, are you there?
Chrissy, I believe we may have lost Martha's phone connection. It looks like.
Oh, thank you for letting me know that. Well, I have another question for Destinee. I know Destinee is still with us. And this is actually a really, really great question that I'm sure some have. How easy was it to get your health insurance to recognize that women can have hemophilia and approve the treatment? A really great question.
Yes, it is, and it's interesting because we had no problem whatsoever with that. Again, I think the fact that she had less than 1% of factor was pretty black and white for the insurance companies. I can't argue with that. She didn't have any factor, so they never gave us trouble. Madison, her sister, her levels are 42%, and she actually has some issues too, but never has had to infuse. And we're trying to get things going with her, so I can understand and appreciate the struggle that other females, teens, young women who have a tough time getting an official diagnosis, because Madison technically has decent levels. I mean, she's at 42%. She shouldn't be having any bruising or joint issues, but with that said, she does have issues with her ankles and one of her knees. So we're kind of starting to see that, not so much with insurance, but just being taken seriously, even by Morgan's own hematologist. We're not really sure if it's even hemophilia related, but in my heart, I do think she has some issues. So I can understand why a lot of women, young girls, do have trouble. But Morgan, in her case, we didn't have any trouble just because I think the fact that she had no factor pretty much said it all.
Yeah, great. Thank you for sharing that. This is a really great question, and if Josh is still with us, I'm going to ask him first. What advice would you give to new parents if the mom is a carrier? Or not? I think this is a good general question as well. I'll let Destinee comment after Josh. But what advice would you give to new parents regarding how early? Well, this is really a carrier question. I'm sorry as I read on. But let's start with what advice you would give to new parents. I will stop rambling. Josh, what advice?
I'm sorry, Christy. I'm sorry. Can you hear me now?
Oh, hi, Martha. Yes, it's good that you're back. I'm just asking for advice. What advice would you give new parents? Why don't we try and keep this really brief, just a couple of sentences. I'm going to start with Josh on advice you would give new parents.
I guess advice I'd give to new parents would be just ask a lot of questions. I guess seek out others that maybe have other experience as well. Just try to, I guess, kind of know that you're not, I guess, dealing with it alone or as the first time somebody going through it. So just ask a lot of questions and make connections to, I guess, learn from others.
Oh, great. That's great advice, Josh. Martha, what about you? What advice would you give to new parents?
Yes, I will say the sky is the limit. If you have questions, go to your doctor, the nurse, the social worker. Go to meeting with other parents also and ask all the questions that you have. Always, always ask. Always talk with your girls and with the new, with your HCT, with your local chapter. That will help a lot, a lot, a lot.
Great, thank you. And Destinee, I'm going to add a little bit onto this question for you. So what advice would you give to new parents if the mom is a carrier regarding how early to test factor levels? Again, I think this is something you should probably talk to your doctor about. But Destinee, what's your experience? Would you wait until there's a symptom? Should they go right away? How early should they test their factor?
Well, if I guess I would follow my child's lead. I mean, you're talking about after you have the child, if you're suspecting it, and you know you're a carrier? Right. Yeah. Okay. Yeah, I mean, trust your instincts. From the moment Morgan was born, you know, her hand, she had a heart defect, so she was in the hospital for a couple of weeks, and, you know, her hand was black from all the needle sticks. And it was kind of in the back of your brain, just something's not right. And she came home, and I just kept asking questions, and just trust your instincts. Don't just take one doctor's opinion, and it's no disrespect to the doctor, but these primary care doctors, they're not trained in the hemophilia like our community is, and we're also well informed now with social media. So definitely reach out to your local chapter, educate yourself, and if you suspect, like we suspected when we were cutting her nails, that was probably the first sign we saw, is when you cut your baby's nails, sometimes that little piece of skin is still stuck there and you just pull it off, you know, and she was oozing. It just wouldn't stop bleeding. So, I mean, it would eventually, but the oozing, her crib would be covered. So it just, those little red flags, no pun intended there, were, you know, recognize those and ask questions, talk to your doctor, and I actually contacted the HCC directly. So don't wait for necessarily a doctor that you're seeing, you know, for well baby checkups to make the decision. You can kind of go on your own and research it and contact your local chapter or your local HCC. And yeah, just trust your gut, I guess, is what I'm trying to get at. Still there? Hello?
Christy, did we lose? We may have lost Christy. We've had quite a few technical issues tonight, but this is why we have multiple staff.
Oh my goodness.
Okay, there we go. There we go.
I am here. I am technical difficulty this time. I was saying we could also check out HFA's website. There's great information on there about how hemophilia and VWD are passed on, so don't forget about the great resources we have as well. Sorry about that. Trying to juggle everybody else. So actually, that was our last question. I also just want to see a couple others coming in here. But we are actually right at the cutoff time, so I apologize for those last few questions that came in. And again, check out our website. And I want to thank everybody for joining us tonight, for taking their time, and especially our panelists who took time out of their evenings and days to prepare for this and to be with us tonight to answer your questions and to share their experiences. A special thanks to them. I hope everybody has a wonderful evening, and thanks again.
Thank you.
Thank you.
Bye, everybody.
Bye. Good night.
Bye. Good night.